Hi, I'm Stephanie, the PT with the Note Ninjas, and together with Nicole, the OT, we help PTs, OTs, and assistants with treatment ideas and documentation. So today, I want to show you this simple activity to set up. You can do this in sitting, which I'm doing now, or you can do it in standing. There's just so many ways we can adjust it to our patients. But let me show the activity first. So what I did is I put a TheraBand around my feet. Again, you can adjust the TheraBand depending on your patient. Put it around my feet, and then I will just have the patient tap a cone. You can change the height of the cone. You could just have something smaller. You could even have a book, just something for the patient, to tap. The cone, you can start with 1 foot at a time, or maybe you just really need the right leg worked, or you can alternate. You can tell them to go slower to really work those hip flexors, or maybe you want them to go fast to work more on endurance. There's so many options you can do. You can also go over, which actually really works the hip. Feels really good. Up and over like this. And this is great, to practice getting out of the car, out of the shower. We really need this motion. And if you can do it with the resistance band, you can do it without the resistance band. And again, you can also do this in standing, or if your patient can't stand, you can also have them sit maybe a BOSU or some unstable surface. If they need, they can lean back. However, by sitting up, they're really working that core strength along with their hip flexor. You can, like I said, increase the time for more of an endurance task, or slow to really concentrate on recruiting the muscle. And then just tell why in your documentation, what you did, the cues you gave. Maybe your patient was leaning over. This happens all the time. So you cued them to sit up to facilitate their core muscles. Maybe you needed them to not lean backwards. Now, those are all your different cues that you could provide. And really is a fun activity, easy to set up, and works so many different things. So make sure to follow us at the Note Ninjas for more treatment ideas and documentation tips.